And we're live.
The song. We played that short song, folks, Zimbabweans across the world, in honor of Zimbabweans that are dying every day in Zimbabwe due to the COVID-19 pandemic. Let me begin by welcoming you to this program. Good morning, good afternoon, good evening, Zimbabweans, depending on where you are. I know here in North America, it's 7 minutes past 2, and I know it's a good evening in Zimbabwe. Thank you so much for joining us. We are live here on ZImbabwe, and we are also live on Change Radio. Thank you so much to our Change Radio listeners. We appreciate you. Today, or tonight, rather, we are joined by the man himself, Dr. Madzorera, the Secretary for Health in the MDC Alliance. We just want to unpack this, pandemic, Dr. Madzorera. People are dying in Zimbabwe. Our people are dying. People are perishing. I think on the 30th of this month, 81 people died. And I think on the 29th, around 100 people. On the 28th, it was around 85 people. We are averaging, official numbers, 100 people are dying every day. And that comes to around 500 people in a week. It's pathetic. It's not words, and I don't even know how I can say sorry to the people that have lost all these lives. Regai totanga nekutoti nematambudziko kune vese vari kufirwa nenyaya yeCovid-19. Dr. Madzorera, welcome to the program. Please greet our viewers and listeners across the world.
Thank you very much. Thank you, Chief. Good evening, viewers in Zimbabwe. Perhaps good morning, good afternoon elsewhere. Thank you for having me on this program, Chief.
Yes, Doc, Zimbabwe, we will just get right into it because I know we have a lot to talk and I know people have a lot to discuss with you and even ask questions. Zimbabwe is on its knees as we are talking with the COVID-19 pandemic. Can you please just give us an overview of how the pandemic is threatening the very existence of our once great nation?
Thank you very much. Very important statement to begin with. Yeah, the pandemic is now biting. It's really biting hard. People are dying in their hundreds now. If you compare, let's say, the last 1.5 years up to end of June, compared with July only, we had 57,626 cases in July only. And from March last year to June this year, we had 49,864. If you compare deaths, they are all in the 1,700s. Comparing that 1.5 year period with July only, we've come to a stage where people are dying in large numbers. General Palace can't cope. I was talking to someone in Harare today. They wanted to bury their relative today, but they told, we can't cope by sending funeral parlor. They've postponed the burial to tomorrow because the undertaker can't cope anymore. This is where we are. People are dying in their large numbers. we associate this with the Delta variant. Government told us 80% of the COVID-19 in Zimbabwe now is the Delta variant. That was about a month ago. I'm sure by now the Delta variant virtually taken over. We know it's a more vicious variant. It spreads more quickly. We are seeing even young people catching COVID-19 and dying, which we didn't see in the two waves of this pandemic. So we are in a real bad place. That's really, yeah, I think by now everybody, every Zimbabwean knows someone who has died of COVID-19 or a relative or friend who has died. That's how common it is now to die of COVID-19.
But Doc, what is going wrong? Because we have facts that the EU, the World Health Organization, the United States of America, the United Kingdom, and most of the developed nations have been sending money to Zimbabwe, millions of them. And at one time, the Parliament of Zimbabwe and the Minister of Finance himself acknowledged the help that they're getting from other countries. Where is this money going to when Zimbabweans are dying every day?
That's a very important question. I sincerely believe Zimbabwe should not be in this position we are in. This disease was never supposed to hit Zimbabwe this hard. When you look at the grace we had for the first 1.5 years of this pandemic, we were not supposed to suffer this much. God never intended it. Somehow we were protected. But it was our own foolishness, greed, the greed of the government. From the start, COVID-19 funds were looted. Around about April, May last year, and that loot was never addressed. We never heard someone has been arrested. We never heard, there were window dressing changes that were made in government, effectively affecting people who were not at the core of the looting. We know the looters, but the looters have not been brought to book. The money was never recovered, though we know how it was looted. Any aid that came after that continues to be looted. The government is not serious about putting money aside for COVID-19. And let's look at the issue of vaccinations. Zimbabwe country with a population of roughly probably around 15 million, and we're aiming to vaccinate 10 million. We've done that and finished already. If government was committed, but tell us, we have 100 million aside, blah, blah, blah. There is no sign that there is any preparation being done. There is any organization being done. It's all promises, a pie by and by the sky. So that's a problem. That's where we've gone wrong. Now, the other thing that has happened is people don't trust the government. Whatever they say, if the government says, let's have a lockdown, people don't the lockdown. They believe the lockdown is being done to lock down COVID-19. People believe lockdowns are being done to lock down the opposition, to lock down certain other people, activists, and so forth. We saw it in COVID-19 judgment. We saw it, people continue to hold meetings and because they are in the ruling party. People continue to meet. Mapostori, for 3 weeks, thousands upon thousands of them meeting. I'm not sure about the actual, geographical point they were meeting, but it's in Manila and somewhere. We say to the government, how can you selectively allow someone to meet like that? Are they not people? Are they not supposed to be protected by the government? But no, it's a political move. It's vote buying, but it's vote buying in the wrong direction. So there's not been any sincerity in the measures that were put in place in terms of containing COVID-19. That's why we are where we are, and people are now dying. It's not the problem of God, it's not the problem of the people, it's the problem of government.
And Doc, we have heard about $1 billion that is coming Zimbabwe's way. Have you heard about that? And what is that money for? And when these organizations give this kind of money to Zimbabwe, do they put in any checks and balances to ensure that the money is being used for COVID-19? Because I still believe that Zimbabweans shouldn't be dying in these large numbers, especially if we are getting the kind of support that is coming from other nations. $1 billion is a lot of money. You can change lives with that kind of money.
That's true. $1 billion is a lot of money. I'm not sure about the specific of this money, but what I gathered from the press is that it's coming in the form of special drawing rights. That means the government can draw down that money as and when they want. And they use it. Certainly, there will be perimeters set by the bank, the IMF, on how the money can be used, but it looks like it's very flexible to me. The money can be used for economic activities, it can be used for social welfare purposes, it can be used for health purposes. What we are saying to government is, we are in the depth of a crisis. A bulk of that money, 50% of it, should go towards strengthening healthcare and strengthening the healthcare workforce, strengthening the institutions, healthcare institutions, strengthening supply of medicines and vaccines, and motivating the workers. I think if the government is responsible and respects life, they could use half of that money towards health, so that at the end of this pandemic, we're all alive and we can engage in economic activities. Right now, with these lockdowns, people are starving their own home. We don't know how much COVID is killing and how much starvation is killing right now. And so that's what we urge government to do, to use this money, not all of it, but at least half of it. We appreciate that we still have to have economic activity in land. They can use the other half for that.
Thank you so much for that talk. You are based in Kwekwe. Let me see. Sarah Nguve is saying, Murisei vanhu asingatarisei nzara kuZimbabwe, vanhu vari kufa nenzara kuchinzi COVID. Ko iyo ndiyo yakuuraya vanhu yoga sei? Zvimwe zvirwere zviripi? Vanhu ngatityei Mwari. Zimbabwe vanhu vari kufa nenzara, zvipatara hakuna, chinhu vanhu vanorarama sei pakaipa. That's Sarah Nguve there. You can try and respond to that, but at the same time, let's just be get into the perspectives here. You are in Kwekwe. You are a medical doctor there. You see patients every now and again. You go to Kwekwe General Hospital. How many people are dying in Kwekwe? Kwekwe was the first city where this deadly Delta strain was discovered. How bad has it been in Kwekwe? And could we have done better in terms of managing the strain in Kwekwe so that it shouldn't have spread this much throughout Zimbabwe?
Right, very important question. Just to preface my answer to that, people are dying in big numbers. That is a fact. People are dying unnecessarily. Many of them are dying because of the poverty of care we are giving to the patients. If patients, one time I was checking out on a certain patient, and I was told that their oxygen saturation was 85%, but the oxygen supply had been taken away and given to another patient. 85% sounded very good to the nurse. There is not enough oxygen in the land, and 85% people can die. I see why have you done that? We only have so many cylinders and we have to move them from one patient to another. So they're trying to juggle a few resources among many patients. That is a problem which we shouldn't be suffering. So we don't know the figures in particular, but I can tell you that yes, the Delta variant probably came into Kwekwe first and then moved on to other places. but we don't, that's another problem. We don't get figures per district or per city like we get figures per province. We've requested figures per district, per city, but those will never come. So let's see. Right now in the Midlands, cumulative cases 7,796. We are not top of league. Marsh West has more cases. Marsh East has more cases. Manicaland has more cases. Harare is about 3.5 times the number of cases in the Midlands. And Lawayo is around 11,000. So you can see, though the variant was first reported in Kwekwe, with relatively fewer cases than the other bigger cities like Harare. But it's the issue of, until last month, we had no COVID-19 admission facility in Kwekwe. Yeah, we didn't. And we've been crying about this all the time. We've had 1.5 years to prepare for it. And we still didn't. Kwekwe Hospital just started admitting COVID-19 very recently. And there is really no other private facility which is admitting. Redcliffe has prepared a hospital for COVID-19 admissions. But, after the burning down of the doctors, the health workers' quarters at the hospital, I'm told some of the doctors and health workers are staying at the hospital, which we intended to turn into a COVID-19 hospital. But that is not Redcliffe's problem. That is the problem of Midlands government and the government, the ZANU-PF government. They've delayed opening of that facility now for over 6 months. And that is pathetic. It could have been opened, we could be treating, admitting patients there for 6 months, but they keep delaying.
Well, Dr. Mnagagwa, will allow you to take a glass of water here as we take a short break and listen to a song here that is speaking to the problems we are having in Zimbabwe by Hosea Chipanga.
Beautiful.
Mabasa ezipatara ipaye kunewe machechi Baba tiri kuchema izune utano wedu mabasa ezipatara ipaye watendi wechokwadi
Well, thank you. We are hearing there Mr. Chipanga bemoaning the decaying health facilities in Zimbabwe. To those who are just joining us, we are live here on ZImbabwe and Change Radio, and we are talking to Dr. Mnagagwa about the sad situation that is going on in Zimbabwe in as far as the COVID-19 pandemic is concerned. To those who want to join on the program, please call on my number Yamambo munoiziva 850-559-6287. You can also type in like what Sunungurai Waishe has done, type in on the comment section and ask Dr. Madzorera some questions or comment. Nzimambo Nachiremba, thank you for the important discussion. Healthcare needs a total revamp. Our funeral parlors are overwhelmed. Aswakuru buying trucks for politicians. Musical staff need medical staff need PPE. Dr. Madzorera is one of the medical staff that we have enough PPE in Zimbabwe, in Zimbabwean hospitals right now. But anyway, we don't want to be crybabies here. We want to be the solution center of Zimbabwe. We always say that Padare is not only about pointing out problems and making you angry about what is going on in Zimbabwe, we also try to proffer solutions to situations that are going on. So, Doctor, any solutions? What would you have done differently if you were Constantino Chiwenga?
Yes, I think that's where we differ from ZANU-PF. The first thing about being in government is your integrity as an individual and the integrity of the political party to which you belong. You must fear God. You cannot loot funds that are meant to service the population. One person loots $68 million worth for. That's complete integrity. So that's the first thing we would have remedied. And in the MDC Alliance, we believe in integrity. We believe in helping the poor. We believe in real social democracy. So just by being a government of integrity, you have solved 1,000 problems already. That means money goes where it's supposed to go. This thing of having entrepreneurs who bring in effective materials and get all the money will never see Zimbabwe or Africa going anywhere. The second thing would have been being proactive in response and understanding the times. These kinds of pandemics, once they hit, each country has to make sure that they deal with it. We had 3 months lead time before we had our first COVID death. With January, February, and March. And in those 3 months, our government did nothing. It's like they didn't believe that the pandemic would reach Zimbabwe at some point in time. Not in this world in where people can have breakfast in Zimbabwe, supper in London. Diseases get everywhere. No public health measures were taken. It's like we didn't believe the disease was coming. No preparation was done. We called on the government to revamp hospitals and institutions basing on what we're seeing happening in China, but nothing was done. PPE was not. Health workers started becoming hesitant to go to work because there was no personal protective equipment. That's one thing we would have sorted out right from the start. And we had the money, a few tens of millions of dollars to buy PPE and other things to prepare. Until today, we don't have enough PPE in the public sector. So that would have been very different. Medicines, one thing I want to say is the ZANU-PF government wants to politicize everything. There's no need to politicize everything. The reports are coming from a politician who knows nothing about viruses. Why not give everything over to the doctors, scientists, other health workers who deal with those things? We have a Department of Epidemiology and Disease Control in the Ministry of Health. They should be running with this method, not politics giving us a post-cabinet briefing. What is that? It doesn't cure the ill in the country. So then government has been interfering with a lot of things to do with management of cases, and they've not availed any money to revamp centers. Even 1.5 years the pandemic started, we still have cities that don't have COVID-19 admission facilities. That is easy to organize. Would organize that. It doesn't require much money to do. And this government must be serious about funding healthcare and social services. Healthcare is very important because you may be important, you may be educated, you may be rich, but without good healthcare, you will die. COVID doesn't know how much you have money you have in the bank. It doesn't care. So to revamp healthcare services for everybody, not just for the rich, for everybody. So those are some of the things we would have done differently. I don't see government supporting our scientists very much. We are still highly dependent on foreign governments for medicines and vaccines. In Zimbabwe, we were really poised to be leaders in the region of medicine production and vaccines, but we have blown that opportunity. Yeah, we could go on and on, but there are many things that have not been done right in management, because there are two sides of management. The first side is the prevention of disease. The second side is the management of people who are already sick. The prevention side has not been managed well. At a time when we should have closed our borders and our port entry, especially the airports, the government of Zimbabwe was still receiving Chinese in the name of COVID specialists. What kind of? They were not even doctors, those guys.
Yeah.
And we were busy bringing disease because of the greed of some people who are busy mortgaging our resources and looking for political mileage all the time, instead of looking at what the people need. So our leaders right now, when I say our leaders, I mean the people who are leading the country right now, whether they're legitimate or not, should not put first priority their emphasis on politics. They should put emphasis on looking after the people, looking after the resources of the nation, and that's the best way to campaign. Look after the people, look after the resources, make sure your people survive and they have good health care. And they'll for you. There's nobody who would ever vote for them now, whether they like it or not, because we have lost so many loved ones unnecessarily.
Those who want to call and ask Dr. The questions, please do so. Emmanuel Nyakonda is saying, are there any deaths and injuries of vaccines yet out? Maybe, Doc, you can tackle that.
Yeah, there are two things that we want to know from government. We want to know exactly what this caller has asked, the adverse events following immunization. We don't know. Honestly, we don't know. I have not seen any publication, and a week or so ago, the president's office gave a report through Dr. Mahomva. I didn't hear anything about adverse events following immunization. The second thing we really want to know is the efficacy of the vaccines that we're using. Again, we don't have any efficacy figures. Is it 50%? Is it 80%? We don't know how much protection we're getting from those vaccines. And those numbers can be calculated very easily by our professors there in the Department of Public Health.
Thank you, Doc. And the Saibo Moyo, Doctor, maybe the nurses need some crash course on the care of COVID patients. And then there's someone who just texted me here. She's saying, Doctor, what is the policy of the MDC on vaccinations? From what you're saying, are you discouraging people from taking vaccinations because there's not much information?
Let me start with the second question before I forget it. If you take anything from us, from the MDC Alliance about vaccination, our message is get vaccinated. Get vaccinated with the vaccine that is available in your locality, whether it's Sinopharm or Sinovac, whether it's Sputnik V or it's a vaccine from India, or whether it's the newly registered Johnson vaccine. Whichever one you get hold of, please take it. It will give you some protection. And the importance of everyone getting a vaccine is the thing that we keep talking about called herd immunity. Some people get vaccinated, probably not self-convert. They will probably not have any benefit from the vaccine. We don't know because we don't have numbers of the efficacy of vaccine. But after vaccinating 10, 15 million people, even those who didn't respond to the vaccine will become protected. So let's all get vaccinated so that those who have been vaccinated and those who have not responded to the vaccine can also be protected by virtue of the number of people who are immune to the virus in the population. So that's the answer about vaccination. Please take this very seriously. We're encouraging everybody to get vaccinated. I know a lot of people who have been vaccinated. I've not heard of any serious adverse events from the vaccines that we're using. I don't know if anybody has died. Yes, people will complain of pains here and there, but those aches and pains need to be investigated by a specialized committee from the Medicines Control Authority if an event has been reported. And so far, I don't know of anyone who has been investigated. So the second question, which was the first, is what? Sorry. The first question.
Doctor, maybe the nurses need...
oh, yes.
Yes.
Oh, yes, thank you. A crash course for nurses, not just nurses, even doctors.
Well, you want the training as well.
Yeah. Fortunately, we have some individual doctors who have taken it upon themselves to pass their own experiences to the medical fraternity. They are holding courses. I don't know who is funding them, but they are doing a good job. Government itself is never. We've been crying for this kind of. It's a new disease. We need to hear it from the perspective of everybody, specialists in various specialties. We want to know from GPs what can we do, what can we do, and so forth. Normal education that happens when a new disease comes is not happening. But fortunately, for most of us, there is this new avenue that there are private players who are now holding Zoom meetings on a daily basis. This week, there were 3 or 4 meetings every day for the whole week, and that has helped a lot. But you don't expect all the nurses and other healthcare professionals to tune into that. Most will be at work the whole day, so they cannot benefit from that. There is need for a special program to educate nurses, doctors, and other healthcare professionals. Not just nurses and physiotherapists have a big role to play. The pharmacists, the entire healthcare team. It's team effort when you're managing a COVID-19 patient.
Yes, and then the last question in our question segment, these people are not writing their names. I'm just seeing numbers coming in with questions on WhatsApp. This one is saying there are 2 super spreaders, Dr. Mazzorera. One assigned, I don't know what she's saying here, assigned to the MDC, and then one caused by ZANU-PF. Zupco buses are super spreaders. Funerals are super spreaders. But we are still seeing MDC officials posting pictures while they are attending funerals. Can something be done about this on both ZANU-PF and MDC? I don't know if it is only MDC officials that are attending funerals. I think it's a common problem in Zimbabwe that people are still attending funerals. I remember I was talking to my aunt in Wedza, and I was talking to them, and they were saying, and I was asking them, kupi mchita kune COVID yakadai ingobatai maoko pamafoni. I don't know what can be your advice and your response to that question. Is the MDC or officials, are they the only ones that are attending funerals? And then you can also comment about Zupco buses. That one she has apportioned it to ZANU-PF.
Yeah, very important questions. Even I think the perspective of the caller is not correct, but the caller is raised very important points which we must talk about. Funerals are super spreaders. When you go to a funeral, you meet with friends and relatives, some of them carrying the virus. I don't think the virus comes so much from the person who has died of COVID-19. You know, it's a respiratory virus. And when we say you are dead, we mean you are no longer breathing. So the dead person really spread much of COVID-19. They'll be in a casket and sealed off. It's the friends and relatives who come, who are symptomatic, who pass. We see a lot of, we've seen whole families getting wiped out after a funeral, and it's really very painful. MDC, we don't, as an institution, we don't attend that many. There's nothing wrong about the president going to mourn with a member. It doesn't mean that the whole MDC alliance is gone to the funeral. We are trying as much as we can not to attend funerals. I've had many friends and relatives dying over the past few months, but I've really attended only 2 funerals. And I really like the last one I attended. In fact, both of them, I attended them in the last 2 weeks. I like the fact that people are now extremely conscious of the hazards at funerals. You know, one funeral where Kubarzeva, and people were really scattered under trees. You'd find 2 people under this tree, 50 to 100 meters away from the action where people are burying the dead, you know. Kubarzeva, people are very conscious now of how COVID-19 is spread. And so, and that many, you know, we are not gathering in large numbers. The only people who gather in large numbers, Atakawana, are the NPF people, and they are burying their heroes and so forth. Yeah, we've tended to see them amassing crowds, but I think they are learning bit by bit that it's not to be done. Then the second question was
ZImbabwe buses.
ZImbabwe buses, yes. So when we talk about ZImbabwe buses, I want to talk about schools also as super spreaders. ZImbabwe buses are a deadly hazard. We see COVID-19 patients every day. When my patients come from Redcliffe, they come from Bizo, they come from Amaveni, and they use public transport, most of them. You see a patient diagnosed COVID-19, they have a car. Do you think they are going to walk to Bizo? 10 kilometers to the furthest part of, no. They're going to board a bus. And in that bus, they will be pegged, there will be standing passengers. And I've seen this with my own eyes, standing passengers.
Dr. Mazorera, can I hold you for a minute there? There's someone on the phone here who is dying to contribute to this discussion, to what you're saying. Wimba, you can go ahead. Dr. Mazorera is listening, and Zimbabwe is listening.
Oh, okay. Thank you, Chief, for having me here. And thank you, Dr. Mazorera, for the information and for all the help that you are giving. Again, it's so sad, but kuona kwangu nekunzwawo kwangu ndekuti mafunerals ndakatomboona kwedu video yakandibata still when I shared with Chief kuti vanhu vachiri kuenda kumafuneral vachinoungana vachiimba vari pamwe chete vachitofara. Takashamisika kuti why are people still doing all this? Dai vanhu takwanisa kunzwisisa kuti tatichimbori nemamwe mararamiro atanga tinawo kudhara ekuti taiungana semhuri seshamwari toona murwere wedu, tochema mufi wedu, toita sendofu yakanaka. But ngatizivei kuti zvinhu zvachinja. This life we are living now is no longer the normal we used to live before. And it's okay not to go kunona murwere. It's okay not to go to a funeral. Tisarege kuda kutya vanhu vanozoti kudii ndikasaita kufuneral. Vamwe tikuenda kufuneral dzeshamwari nedzehama dzeshamwari dzevanhu vekure kure vasimbori even close relatives kwatiri. Dai Mwari vachibatsira ndomunamato wangu. Dai tagona kunzwisisa kuti tagona kuchinja. I know sometimes it's hard kuti tichinje, but patave panapa kuti family one iri kutsvairwa within even a week or 2 weeks kuno vanhu vakawanda even 5 people vari kuenda. Vanhu ivavo vakanoona murwere achirwara, ngatitritei munhu wese ari kurwara kana kuti asingarwari as ane COVID. Let's just treat each other like I have the COVID. Because mukanoona murwere muchiti haana COVID, maybe haana kungoonekwa kuti anayo, but anayo. And then momutreata moya kufuneral kwamiti amai yangu haina COVID, munozara ikoko moita sei? pamunobva kufuneral ikoko zvimwe zvinogona kuitika tinongonamaswa nyasha dzaMwari kuti dzipindire, but aichangogona kunzwisisa kuti patave kurarama iko zvino pakaipa zvataisimborarama zvachinji kurufu ndokune ndingatikwa kune poto ine mushonga mubhaibheri Elisha finds there is danger in the pot. Kurufu kana kuona murwere varipo vandakatonzwa vakabva kufuneral vane funeral right now nekuti vakaenda kufuneral dzevamwe vakadzoka vakarwara ende ivo vanenge vatori vapenyu vasakanga kufa dzimwe nguva ndeva vanga vasatomira kufika. Saka ipapo dei hama dzangu ka Mwari vatibatsira tanzwisisa kuti it's okay nevanenge vafirwa nzwisisai kuti it's okay kuti vanhu varege kuuya, musafunga kuti hamuchadiwi kana kuti havana basa nemi. Vanokudai but vari kuda kuti vadzivirire upenyu kwete hwavo chete but hwevamwe vanhu. Vamwe tine vana mudzimba vana vakawanda maybe 10 kids. Imagine amai kana baba maenda kufuneral makuuya kumba kune vana vakawanda kudai so chinozoitika after that. Muri kupera muri kuparara. Saka taitangonzwisisa kuti takurarama munyika takurarama zvinhu zviri different. It's no longer the normal life we used to live before. Kungovhakachirana kuti takuenda kumapati kana kungoona hama yangu ngatigare mudzimba ndozvirimo nguva ino yatiri. Kana mubhaibheri iripo nguva yekuti vanhu vaimbogara panzvimbo 1 vanhu vaimbogara vakamanikidzika vasingabudi. It's normal. Let it be the normal life now. Tombosiya the other normal life yataimborarama kudhara nekuti spreading yachonaka iri kutonyanyisa patiri kunoungana ipapo tifunga kuti murwere wedu haana covid because haana kutestwa positive. Chero akatestwa positive guess what ari kunoonekwa. Ndakatonzwawo nditori namayangu yandakatonzwawo kuti atanombonomuona ndakatotedza kana kubvunza kuti mamuona sei iye akatestwa positive. So handiziva hangu but dai ivava vari kutungamira vagona kuunzawo kuda vanhu mumaruwa nekuti variudze vanhu kuti ngatiregei kunge takaungana. Kana kuchinzi vanhu vashoma ngavatoenforsa mapurisa auye kana kwanzi kwaitika rufu iwaye masabhuku machifi mapurisa ngave involved. Ngavadzosere vanhu kumashure ngavadzosere vanhu kunze kwegedhe kuti amupindi kana muda kupinda regai vamwe vachange vabuda imi mozopinda kana vabva kure maybe ndo vanonzi vabva kutaundi but vemaraini umo ngavadzosere kudzimba dzavo. I think this will work kana patoiswa vanhu on the ground to enforce this kubva kumasabhuku vanonida kueducatiwa education because this is a lack of knowledge. Even though vanhu vachiparada zvinorwadza. Ini nditofirwawo nehama dzangu neshamwari dzangu dzotofa necovid. Vamwe vanotofa vari 3 within a week family 1. It's so sad. But unoona kuti vanhu vanenge vachienda kufuneral havana mamaski vari kungotaziya hapana social distancing. It's like normal life is usual.
Well,
Handiziva hangu but I think enforcement iri kushota iri kushaikwa. Handina mupa ndakamboiona kana hapana pandakamboiona. Saka dai taitirwa nyasha ipapo mapurisa ngaende on the ground masabhuku ngave nemapurisa ana mambo chief nemapurisa enyimimi ngavatoita basa kana kwatoitika. They have to be on the ground. They have to educate people and be on the ground. Pana parikubvumidzwa vanhu vangane veukama vepadhuze chete. That's it. Vamudzokerai kudzimba dzetu. Ngatitenya thing that contribute.
Imbai waita basa rakaiti ngoti Dr. Madzorera vanotichipa ma-contributions awaita akasimba kudaro. Dr. Madzorera, the new normal hanzi timbomira kuenda kumarufu mapurisa ngaauye achitoenforsa kuti vasapinde vakawanda pamarufu. Hanzi vanhu vari kudyira poison kunyara kuti ndozonzi handa kuenda kunhamo kwasekuru. What's your comment on that as you also finish up your analysis of the ZUPCO buses?
Yes, I agree. Martin Dimbai handiti.
Dimbai mwana wekwenyu kumidle kugogo kumidlands
kwenyu. Yes, that was a very powerful contribution. And I like the words she used, the new normal. It can't be business as usual in this COVID pandemic. And I want to agree with everything she said. You don't have to attend every funeral. And funerals must be strictly monitored Tirikushayiwa monitoring. Mtemo watakuwa ndokuti 30 people are allowed to attend a funeral, but you find kune vanhu 200 funeral. That is not good. Mopedzisa mhuri dzese. I want to combine it nepatizo masabhuku ngavaitewo monitor kumareserve. I want to see masabhuku, they are turning out to be some of our chief super spreaders now. I received 2 phone calls this week. I don't know why they're doing it, but they're gathering people. 200-300 people are meeting. We've been receiving reports. 200. Better say. We try to explain to them, but to disobey their traditional leaders. Masapu kungayambire zvavari kuita bvumidzwi shata ngavarege zvokuunganidza vanhu for no good reason. Haisi nguva yokuungana tichiita political meetings zveindoctrination zvisina nebasa rese. Mazup buses, they are, as I was saying, they are the big super spreader now. If you're in a bus in around 20 or more, you must know that there is 1, 2, or 3 vanhu positive for COVID imomo, whether vachizviziva or vasazvizive. And the sphere yemuya enclosed, it's very dangerous. You will surely get COVID. Vana vechikoro, the government is planning to open schools now, and saying talk to the teacher unions, talk to the parents, see what can be done. Don't just bulldoze and dictate and say takuvhura zvikoro. Izvo zvikoro zvavo zvisina kugadzira. It's better to come to 2022 vana vasi kuenda kuchikoro tozotanga patsva vari vapenyu vana vacho. The tragedy about COVID is mwana anogona kubata COVID yake kuchikoro ouya kumba iye anongorwarawo mbichini semwana mudiki asi obva vana baba namai osara avanherera. That we've seen it happening, and it must come to an end. The government must realize that it's a political party. It belongs to all of us.
Well, Dr. Mazera, thank you for that explanation. I will take the last caller here so that we round up. I know you have other engagements. He's appearing on my phone as DJ Professor. Professor, you can go ahead and join the discussion here. Professor, if you can raise your voice.
Okay, thank you. Can you hear me loud and clear now?
Yeah, we can hear you now.
Thank you very much. Let me just say thank you to the program, and thank you very much to Dr. Mazorera for coming to clarify some of the things around that issue of COVID and stuff. But just maybe to my contribution to speak more specifically on the topic, which is that ZImbabwe Perishes, Mnagagwa loots, and I agree fairly well with the subtopic, because look, I begin to wonder, and I think focus my mind when now I heard that in Zimbabwe the Mnagagwa government, or what if it's government or it's himself, that they are buying twin cabs cars for the people who lost the 2018 election who are in Poland. So my question is, where is that money coming from if it's not our COVID funds that were donated to safeguard the health of people, and now it's used by individual person to strengthen, or basically to say thank you to the people who were sitting with him doing nothing there. The second point, Dr. Mazorera, and the listeners around, and I want to point out, is that the problem again comes when we start politicizing the issue of COVID. For instance, you find out whenever now ZANU-PF are being asked about looting of the COVID funds, the questions that they always give is that you are not giving the fact that we are the lowest country with COVID, positive COVID-related issues and few deaths and stuff. But my point, I think they are also not doing justice to the people of Zimbabwe. The first thing is, do they have enough apparatus or enough testing, vaccine testing to show what population of the people who are positive in the country. The second thing is that is the number of deaths, people which are COVID related, is it the correct number that is being said to the people of Zimbabwe? Or else they just want to publish the few numbers that people will say we have. Because honestly, what have we done in Zimbabwe? Or what has the Zimbabwean government done that is totally different from any other country in the world that makes them to be the best? That's my question and that's my contribution. Thank you very much for this program.
Okay, thank you, Prof. He's calling from South Africa. Dr. Madzora, I think you can tackle those two questions.
Yes, thank you to the Prof. I quite agree with the numbers of people died from COVID-19 may not be accurate. What the government reports are the reported cases, the cases that we report as healthcare workers. There are many people who die without ever visiting a health institution, and they get buried. We don't know about those. So the actual figures could be much higher. As to whether the government is tinkering with the numbers reported, I don't know. I cannot answer that at the moment. I hope they are not. So there was another issue of, do we really know the correct number, the correct prevalence, I would say, of people with COVID-19 in Zimbabwe? The simple answer to that is no, we don't know the correct prevalence because we are not testing enough. Even for people we suspect clinically to have COVID-19, sometimes we fail to test because the tests are expensive. And sometimes we just end up doing the cheaper antigen test. We call it the antigen test. And I've seen lately that is giving us a lot of false results. People who should be positive are testing negative. Then you eventually do a PCR test and it comes back as positive. And you have lost time when you could have been treating the patient, and such patients often end up dying because of lost time. So it's pathetic. Government should not have lost COVID funds, should have invested in PPE, we should have invested in diagnostic equipment, and we should have invested in hospitals and oxygen. Those things alone, without worrying about ICU, to be honest, if we had those things in place, they would not have lost as many people as we are losing now.
Thank you very much, Doc. And as we round up, can you please address the people of Zimbabwe on the way forward? Is there any hope for Zimbabweans, or we are just going to continue to perish? You are a former health minister. Maybe you can draw from your experiences as well. And you can also touch on the role of the people in the diaspora, how we can help, how we can come in the equation here. After all, we are contributing over $1 billion into the Zimbabwean economy. What can be done to make sure that together as Zimbabweans we serve our nation?
Powerful. Thank you very much. The first thing I want to advise Zimbabweans is, when it comes to matters of health, let's take matters into our own hands. Let's demand what is ours for government. Let's not just sit and expect a few politicians in the ring to speak on our behalf and to be activists on our behalf. Let everybody be an activist for health. Let everybody be an activist for social welfare. We saw people die of hunger, during the lockdowns, and nobody raised their voices. Okay, as politicians we speak, but we need the authority of the people. We need to be pushed by the authority of the people. You can't just speak like a lone ranger in this world. So please make noises, demand what is yours. It's your right to have leaders of integrity. It's your right to have is accounted for properly. Don't accept hogwash leadership. The second thing is, let's do what we can. There are certain things that we as individuals can. We invite some of those things. Issues of attending funerals, let's cut down on that. You don't have to attend. Now people are doing funerals on Zoom, you know. So let's not attend funerals. Let's sit in our house. Let's not go out unless we really have to go out to the shops and so forth. Let's get vaccinated. Get vaccinated. Whichever vaccine is in your neighborhood, it works. It helps. Then let's seek help early. Don't wait until you are bedridden to seek health care. We are seeing that in this pandemic, people who seek health care early and who get diagnosed early actually tend to fare better because we monitor you. We know now we're at this stage. We are now supposed to give this kind of medicine, and we walk through you. And you may not even need admission or intensive care unit if you come early. Let's take care of our other comorbidities. You know, if you're diabetic, hypertensive, and so forth, please look after yourself. Stay at home. You're in a higher risk category, so you must, quarantine yourself even more during this time. Those are some of the pieces of advice we can give each other in order to survive this very horrible pandemic.
And then the diaspora aspect.
The diasporans, yes, diasporans. I want to thank diasporans. I won't name anybody, but I'll say there are some diasporans who have been very active supporting the nation. We called for PPE. Some diasporans responded and funded some PPE. I wish the pool of diasporans doing that was bigger because the need is still great. Right now, the need for oxygen is great. And there are little gadgets called concentrators, which some people are using now, to concentrate oxygen. They work. And if we can have those, the diasporans can buy lots of concentrators for us. Don't give up on your relatives now. This is a critical moment. We need to survive. It will probably last another year or two, and then we'll be out of it. We can be happy, with our relatives. They're all there, vakakwana. So we still need a lot of financing to help, because government will not do everything for us. So I've mentioned PPE, concentrators, and some medicines also, but I cannot name any specific medicine. And I think the best way to help is just to support our relatives to buy medicines prescribed for them here by the doctors, the healthcare workers. So you are very important in this equation. We appreciate what you've done in the past, especially in terms of PPE. Please do another round to support. Some have even pledged to support institutions. There are some institutions which are now run down, broken. They don't have a single bed with all the springs in it. They need just resuscitating one ward will go a very, very long way. You can't all Zimbabwe's problems alone, but you can make life better for one more patient in Zimbabwe. So let's not give up. Let's get organized and start supporting our motherland, specifically in healthcare.
Well, we want to thank you, as ZIMI, as Change Radio, Dr. Madzorera, for coming here and enlightening us. You've given us a lot of information here, and our contributors who came in, Vimbai and DJ Prof, thank you for your advice. I also want to thank our backroom staff, Estella and Leo in the background. Thank you so much for that. And of course, you, our valued listeners and viewers, thank you so much. Please, let's take heed of what everyone here has said. Let's get on the phone right now and start calling anatete kumusha uko anambuya, anasekuru, anani, vese kuti varegere kudyira poison kunyara vambomira kuenda kumarufu. Here in America there was a time when we're doing a funeral on Zoom, and I think that should also start happening, especially in urban areas. And my politicians, katimbomirai kuenda kumarufu. We are the people that people look up to. So if we stop going kumarufu, vamwevese vachadaro. So let's spread the word. Thank you once again, Doctor. We appreciate what you're doing on the ground. Stay safe. And as Zimbabweans, wherever you are, please stay safe and stay in touch with your loved ones. Thank you. God bless you.
Thank you very much, Chief. God bless you, listeners.
Thank you.
Mwari tiri kuchema isu neutano hwedu, mabasa ezvipatara ipai kunewe machechi.